followers more about rheumatological diseases in Pakistan?
First of all, I would like to give some information about rheumatology. What is rheumatology? It is a specialized field of medicine that deals with the diseases of bones, joints, and muscles. And we treat patients by medicines, and in some cases, we have to give them injections. There's no surgery involved in our treatment. If we talk about the rheumatological diseases, there are more than 100 diseases known worldwide. The commonest one that I would like to talk about is rheumatoid arthritis. People call it Gantia or Gartia in Pakistan as well. It is one of the inflammatory arthritis. That means that your joints will get swelling, pain, and stiffness. So if you ask me the reason behind this problem, most of the rheumatological problems are autoimmune problems. That means that your body is attacking your own tissues. They're producing antibodies and attacking their own tissues and causing swelling and pain. And it does not only cause inflammation in the joints. It can cause problem in your muscles, ligaments, heart, eyes, other organs as well. Like I said, rheumatology and rheumatoid arthritis is very common in Pakistan, especially in females. People will experience these symptoms for a couple of months. I would like to emphasize on the fact that people should come and see a specialist if they are having joint pains, especially if they are going on for a couple of months.
So Dr. Saadia, can you please share some tips and tricks with your audience regarding the bone health?
It's very important to emphasize on the fact that most of these problems, they can get worse with obesity. So our lifestyle is very sedentary. We don't do much of exercise or physical activity. So I want to give this message to all the viewers that they should adopt a physical activity. I know it's very busy daily routine and we don't get much time to go out, but you can start with simple walking or exercise, maybe few minutes in the morning or in the evening. So that's one thing, weight control. Second thing is to eat healthy. Like you've seen, our lifestyle is more towards fast food and fried food. So we should try to avoid that and focus more on fresh fruits and vegetables. I normally ask my patients, do you drink milk? And the answer is no. So we can emphasize on drinking milk and using dairy products. And fish, meat is also very important for your bone health. So overall, if we mix the combination of these three things, improve your lifestyle, involve a daily activity, physical activity. Number 2, improve your eating habits, try to eat healthy. And number 3, if you're suffering from any sort of joint pain, for example, any arthritis, you should get a proper exercise or physiotherapy for that damaged joint.
There are various myths regarding this disease. For example, that females having arthritis cannot expect babies. So what is your take on it?
It's very common in our society that whenever a patient is diagnosed with a rheumatological problem or autoimmune problem, they start getting information from other people, for example, other family members or hakims or other people. And most of the time, the patients are advised to stop medicines by these people who are not medically qualified or doctors. So my message to all the patients who've got any autoimmune problem, they should take their medicines regularly. They should follow up with their doctor again regularly and get your blood test done. Normally the ladies, they have this fear that they won't get pregnant or they can't have a normal pregnancy. I always emphasize that if you are on a regular follow-up and you're visiting us and we are adjusting your medications, you can actually have a normal pregnancy. In fact, all these problems, all the autoimmune problems, they improve during the pregnancy due to the hormones. So if you are under the observation of a specialist doctor, you can have a normal pregnancy and normal delivery of the baby. Second myth in Pakistan is the use of steroids. Whenever I prescribe patients some steroids or painkillers, they just say, no, we don't want to take it. There are lots of side effects of it. My answer to the patient is that if you are taking these medications under supervision for a shorter period, couple of weeks or months, and your doctor is observing the side effects, you can take them. And in fact, steroids are very helpful in the cases of inflammatory arthritis.
What is the common age group which can be impacted by this disease, and can it also affect the children?
These autoimmune or rheumatological problems are more common in young people and young females. If I give example for the problems, in female the common problems are rheumatoid arthritis, systemic lupus erythematosus, which is called SLE, fibromyalgia syndrome, or other connective tissue diseases like scleroderma. These are the category that's common in female. However, in males, the commonest cause of these problems is gout, which is related to high levels of uric acid in your body, and then again some crystal deposition of these uric acid in the joints. And the other form is psoriatic arthritis. Psoriasis is basically a skin condition, and the patients with psoriasis can develop joint inflammation as well. And the third that's common in males mostly is ankylosing spondylitis. That is the problem that affects your backbone. So in ankylosing spondylitis, the back is usually affected, and there's inflammation in the joints of the back. The next category is the one that is affected in the elderly, that is osteoarthritis or osteopenia or weakness of the bones. And it's very common in children as well. That's unfortunately a misunderstanding in Pakistan, that these problems can't affect children. Like I said, juvenile rheumatoid arthritis is one of the disease that is affecting the children. It can start from any age up to 16, and again causing the problem of joint pain, swelling and stiffness.
What are your thoughts on Hakim and herbal treatment? Are they really effective?
I would like to give this message to my patients that please do not go to Hakims and quacks. We don't know what medicines they are giving, what are the side effects of these medicines. If I give you an example, I've recently seen a patient who was taking Hakim medicine and she developed kidney failure because of this. So my advice to the patient is to go to a proper authentic specialist doctor who can look after your disease and suggest you the medicines and call you for a follow-up. When we ask patient to come and see us again in few months time, the aim is that we are looking at any side effects from the medicine, and we are checking the progression of the disease, if it is settled down, which is called remission, or it is going in an acute flare.
Dr. Saadia, just one last question. As it is said that prevention is better than cure, so can the early and aggressive treatments can prevent these diseases?
First of all, patient need to understand that there's no cure for these autoimmune diseases. Like I said about rheumatoid arthritis, for example, they are long-term chronic conditions. So what is happening is that when this problem is affecting your joint, it is causing inflammation inside the joint. And if it is staying for longer duration, for example, few years, it is basically damaging the joint inside, and then your joint will become very stiff and damaged, and you won't be able to do any sort of physical activity. So my message to the patient is that if you're coming and seeing a doctor early when your pains are actually started and you're given an aggressive treatment, we can actually prevent the damage of the joint. And once we are preventing the damage, we are preventing you from any major disability.
Do you have any messages to convey to our followers?
I would like to give this message that if you're having joint pains and they are going on for a couple of months, please do consult a doctor, because we need to find out if it is an inflammatory arthritis that is going to damage your joint permanently. So if your disease is getting diagnosed early and you're receiving treatment early, we can actually prevent you from any major disability. So as they say in our rheumatology, early treatment can prevent you from any major disability.